Hypercalcemia is a medical condition that causes increased levels of calcium within the blood. These increased serum calcium levels create health abnormalities which we recognize as symptoms of hypercalcemia. Now, the degree of these symptoms is dependent on both the patient's overall health and the speed of calcium elevation. As these symptoms present themselves, a blood test is taken to identify whether hypercalcemia is present. So hypercalcemia is diagnosed according to the patient's blood calcium levels. When the serum calcium level is more than the 8 to 10 mg per deciliter average, it is diagnosed as a degree of hypercalcemia. All forms of hypercalcemia require treatment to moderate calcium levels and relieve symptoms, most commonly done through intravenous hydration or medication. As hypercalcemia is generally caused by pre-existing health detriments, addressing the underlying cause is also used as treatment. Primary hyperparathyroidism and cancer are the leading causes respectively, contributing to 90% of all cases. These factors accumulate to give hypercalcemia a global prevalence of 1%, which is significant due to its effects on the body systems.
Within the endocrine system, at the posterior wall of the thyroid glands, sits the 4 parathyroid glands. They play a crucial role in maintaining calcium homeostasis through the secretion of the parathyroid hormone. The parathyroid glands are made up of parathyroid tissue, derived from endodermal tissue on the thyroid glands. The cellular composition of these glands includes chief cells, oxyphil cells, the parathyroid hormone, and blood vessels. Chief cells synthesize and secrete the parathyroid hormone, which participates in calcium homeostasis. By stimulating the bones to release calcium, it can increase and deliver calcium through the blood to be absorbed in the digestive tract and kidneys. At a cellular level, calcium is then passively transported into the membrane via ligand and voltage-gated channels, while calcium pumps actively transport it out of the membrane, thus maintaining calcium homeostasis.
The skeletal system outlines over 206 bones, cartilage, ligaments, and tendons. The significant functions of this system are to support the body, protect organs, produce blood cells, storage, and to facilitate movement. Bones. Bones continually sustain change both structurally and biologically throughout their entire lifetimes, depending on the demands placed on them. So what is the main property that gives bones their ability to remodel? Osteoblasts discharge a solution called osteoid, which then hardens after undergoing mineralization, while calcium phosphate nanocrystals fill the bone matrix. The main anatomy of the bone ensues the cortex and the trabecula. The cortex is a dense, thick outer shell made up of osteons, with the main purpose of protection and strength. The trabecular bone tissue is the porous meshwork-like material that can be found at the epiphysis and metaphysis. The sponge-like quality allows for storing mineralized bone tissue for the essential task of erythropoiesis. Both cortical bones and trabeculae are components of all bones except the vertebra, which only consist of dense trabecular tissue. Periosteum, the membrane made up of blood vessels and nerves, surround bones and are crucial to perfusion and the supply of nutrients. Other parts of the bone receive blood through Volkmann's canals, which penetrate the cortex into deeper parts of the cortical bone and marrow cavity.
The endocrine system plays a crucial role in regulating calcium levels in the body. Consequently, any disruption made to this system will result in hypercalcemia. More specifically, parathyroid glands, which are located on the posterior thyroid gland and are part of the endocrine system, help to regulate calcium levels in the blood by producing a hormone known as the parathyroid hormone, which is abbreviated to PTH. PTH engages with the kidneys, bones, and intestines to increase calcium levels in the blood when they're extremely low. Having said that, when there is too much PTH in the bloodstream, it can lead to hypercalcemia. This condition directly relates to the normal anatomy and physiology of the endocrine system, since it is regulated by the parathyroid glands, which play a vital role in maintaining calcium homeostasis in the body, affecting chances of experiencing hypercalcemia.
The skeletal system is made up of bones, and is the system responsible for supporting us and enabling movement, but it is also the largest reservoir of calcium in the body. Calcium is stored within our bones and is also necessary for them to grow and become stronger. Normally, our body relies on calcium to create new bone tissue. This happens in a process known as remodeling. Cells known as osteoclasts break down the bone, which releases calcium into the bloodstream. Cells known as osteoblasts replace this with a layer of new bone, using calcium. Hypercalcemia can happen if an external factor like cancer or hyperparathyroidism causes the body to lose more bone than it can generate. Regardless of the cause of hypercalcemia, if it's not reversed, the ongoing liberation of calcium from bone stores through activation of osteoclasts leads to osteoporosis. Osteoporosis is when the bones are thinner, weaker, and more likely to fracture. This is because the bones become less spongy and more porous. This can be detrimental for the skeletal system.
Our bodies are amazing because they're made up of multiple systems that work in harmony so that you can talk, think, and everything else imaginable. When one system becomes impaired, this can impact the functioning of other systems such as the skeletal and endocrine systems in the case of hypercalcemia. We already know that a common cause of hypercalcemia is an impairment in the endocrine system, hyperparathyroidism. The calcium-sensing receptors on this gland detect changes to the extracellular calcium ion concentration, prompting the secretion of PTH and subsequently higher osteoclast activity. Osteoclasts are cells which dissolve old and damaged bone, and so higher osteoclast activity can severely impair the skeletal system, as it leads to bones which are susceptible to fractures or disease such as osteoporosis. Furthermore, when osteoclasts break down the bone, it is reabsorbed into the bloodstream, increasing the extracellular calcium ion concentration and risk of hypercalcemia. This would normally prompt the parathyroid gland to prevent PTH secretion, however its overactivity prevents the regular negative feedback loop. Another cause of hypercalcemia is malignant tumors, which can release a proteinaceous hormone called the parathyroid hormone-related protein, mimicking the effect of PTH. This hormone impairs the skeletal system in the same way as before by increasing osteoclastic activity and breaking down bone faster than osteoclasts can build. This increases the extracellular concentration of calcium ions, thus contributing to the development of hypercalcemia.